Good morning, everybody. Thank you for coming to listen to what I've got to say. I hope you find something of interest in it. I am the Health Services Manager at a minimum security working prison in Northern Victoria. I've been in the role for 5 years now, and having worked in the prison for 8 years. A little bit about Correct Care Australasia, who are my employer. The largest correctional healthcare provider in Australia. We only in Victoria, but out of the 13 public prisons, we've got them all, and there's 2 private prisons. So we provide the healthcare to the prisoners, around about 5,000 prisoners, 4,000 to 5,000 prisoners in Victoria. So Correct Care originally registered as Pacific Shores Healthcare back in 1998. They commenced the healthcare delivery in the public prisons in Victoria. We've had a couple of name changes, but basically we're still the same company. We're contracted through the health branch of the Department of Justice and Regulation, and Justice Health is our governing body. We have a contract with them. So what does health promotion look like in a prison? I don't know if you know anything about prisons, but it's health promotion in any medical setting is very similar. So we have health education, we have health literacy, we have immunisation programs, we have a very captive audience, they can't go far. I don't have walls in my prisons, but some of the prisons in Victoria, obviously, the maximum security and all that have walls, but mine can just walk off and regularly do. We have a secure environment, really. Corrections Victoria supply the security officers and everything, so we really are a protected group of people. And we're holistic because they can't go home. They can go to the doctor and see the doctor, but they can't go home, so we provide all their care. We provide their medications and everything. This is just this old mansion. There's a history there. It used to be a boys' home. This is where I work at Dhurringile. These are some of the accommodation units there, and we're in Northern Victoria. So we're a nurse-led model of care in all our centres in Victoria. My centre has 7 permanent nurses, 3 mental health trained nurses, and we're all general trained. We have 2 visiting local GPs, a visiting psychiatrist and a podiatrist, and we have off-site allied health. They get escorted to dentists and X-ray departments, and a lot of the prisons have their own X-ray departments or have visiting X-ray consultants and a bit more facilities on site, but because we're minimum security, some of our guys go off. And they're taken off with the officers. So just some statistics that I think that some of them are very, very relevant, and some of them you would think, oh yes, well I understand that would be right. So 25% of prisoners reported they were homeless prior to incarceration. So that's a quarter of our prisoners reported that they were homeless prior to being in jail. Now that impacts on what we do for them for their release and what you do for them in the community. Because let me tell you, when they come out from the jail, they come back to your clinics and your medical centres and your facilities, and you have to deal with them and you have to look after them. So 31% were going to be homeless on release. So we can't even send them out to a home, which is a really devastating thing that somebody doesn't have a basic home to go to. 48% were unemployed. I suppose you would think that would be a figure that you would, yes, that could be right. 79% were on government payments. So it's a drain on our society, it's a drain on our resources, and it's a drain on our medical system. 39% of prisoners reported they did not complete school above year 10. So we do have a problem with illiterate men and women as well in the women's prisons. So these were all things that we had to deal with, looking at how we were going to manage their health and educate them to be healthier people. So these statistics, have come from the Australian Institute of Health and Welfare, the health of Australia's prisoners. So there was a survey done in 2012 and it was repeated last year, and we've seen some improvements in some areas and we've seen some declines in others. 74% of our prisoners reported smokers. Now, I must say this is not just Victorian numbers, this is Australia-wide, so it would vary in states, but this is the best information we got. So 74% were reported smokers, and I don't know how many of you know, but in 2015, and July 1st, 2015, we banned smoking in prisons. Boy, that's been unbelievable. But anyway, that's another story. 58% have had alcohol-related harm. So we talk here a lot about ice these days, but alcohol probably would still be one of the highest problems, alcohol-related harm. 70% use illicit drugs. So it's not just ice, it's heroin, it's anything, you know. So 49% had diagnosed mental health disorder. That means there was a lot of undiagnosed mental health disorders as well, and some that were diagnosed but really weren't diagnosed. They were just some sort of psychosis following illicit drug use. 31% of our prisoners were Hep C positive. So just recently this year we've started a Hep C treatment program, which has been very successful through St Vincent's Hospital. Now that we've got the new drugs, the oral medications, which is just great. So you will be, some of our guys who've started the program will be followed up in your clinics with these drugs. So. Oh, look, the amount of prisoners that have actually given up is very small, I think. I think a lot of them will go back to smoking when they get out. I could talk for 3 hours on it, so I hope that it has an impact. If personally, and this is not a comment from anybody else, this is my personal opinion, I think they shouldn't have done it. Just because, no. But that's my opinion, not anybody else's. I think that we could have put more restrictions on it. But it occupies every prisoner's mind 24 hours a day, every day. Where can I get a cigarette from? I'm struggling. No matter how many programs and NRTs we had available, they don't want to give up smoking. Anyway, I'm sorry, I need to move on, but I can't. Yeah, it's a big topic. We could discuss it for ages. 26% of prisoners had a new diagnosis in prison. So what we found was that a lot of them had not actually been to a doctor in the community for a number of reasons. Bulk billing didn't happen. They didn't want to know. The drugs occupied them. You know, there was a lot of other things that they were considering. Some of them were on the run. They didn't want to get stuck to any one place. 32% had been told of chronic health conditions in the community, so they knew they had something wrong with them. Only 66% of prisoners saw a medical practitioner in the community in the previous 12 months. So they weren't going, medical care was not high on the priority list for these guys and women. 56% of prisoners were on medications. So in our setting, we manage that as well. We issue the medications, we order it, our doctors prescribe it, and so we do the whole lot. It's a holistic. 71% of prisoners received health information about their conditions in our nurse clinics. So being a nurse-led model, our clinics were where we consulted with the prisoners and we did their chronic health care planning, and we did all the, plus, you know, emergency reactive stuff. If someone's got a cold, we treat them and discuss what their plan is. 57% reported an increase in their weight in prison, so they may have come in as active people in the community, go with their children to sporting things, come to prison. What do they do after they finish work for the day? Or what do they do if they're locked in a cell for 23 hours a day? 21% reported a decrease in their activity whilst incarcerated, so there's no incentive, quite often there's no incentive for them to be active. They're in prison, they want to do what they want to do. 37% reported better health whilst in prison, so I think this is a really good figure for us, and I hope to see this in the next survey raise up even further, and that would be us doing our job. We're promoting health and better lifestyles, and informing the guys. 69% of our prisoners Australia-wide were tested for BBVs, so we offer a screening process and an immunisation program as well. And there is a big push for that to be much greater than 69%. We're doing immunisations this year, and we're hoping to get an 80% immunisation rate, which it's out there, but we're hoping to do it. Bloodborne viruses. Sorry. So what happened with this Men's Health Days? We identified a need for a proactive approach to health, to promote health and wellbeing, to educate our prisoners on health conditions, and to reach out to prisoners who do not attend medical centre regularly or at all. So we've got our guys who have their medical conditions. They already know they've got them. We're managing them. These are the guys who come to prison. They're healthy. They still need their men's health checks. They still need their regular checkups and the information that's out there for men, and at ages when they need to be, your prostate checking and all those sorts of things. So we saw a need to do that, and we wanted to do it not a one-on-one because that takes so much time. We sort of thought we could probably do it as a group activity. So I identified a core target group, and these were the ones who didn't often come. We identified partners and communicated our plan. So we had to have permission from Corrections Victoria to get these people to come on site to give the health information to the prisoners. We had to identify our potential outcomes, and we sort of did all that and realised that we wanted to create a healthier population of men, and develop and acquire relevant resources. So that we had to look at our partners and what information. We've had contact with the Kidney Foundation and all the Beyond Blue and people like that to get the information that we wanted, that these guys needed. We wanted to have an evaluation and reporting to partners. So I started this in 2014 just as a local thing, and it was quite successful. And so the other prisons are looking at doing it in different ways. They can't all do it as a minimum security and have everybody come in and have all the prisoners attend, but there are ways that we can do those things limited. So this was our day. We decided that we'd have different foods that they wouldn't normally eat. They'd probably have sandwiches and things like that for lunch. We thought we'd have fresh fruit and wraps, and fruit that they get fruit, but for their lunches, but not exotic things. Bananas are a bit, unless they're really cheap, they don't have bananas all the time. So just different variety of foods. We were in our visit centre, so that all the prisoners came to the visit centre. So it was in a secure area, and we had said we'd have 100 prisoners. And we had a prisoner band who we decided that they would entertain at lunchtime, and that was very successful. There was women there, they probably would have danced. We decided that to get them there, we sort of had to do something to reward them for coming. So we looked at having a celebrity or somebody to come so that they go, I want to go and hear what he's got to say. Lindsay Fields, 2 days before the event, and I hadn't been able to secure anybody, said, I'll come. I'll cancel my appointment that I've got Thursday morning. I'll come and I'll sing and I'll tell my story. He's got a very interesting health story, and he was very well received. He was just magnificent. We've had a couple of... Peter Chisnell was an ex-AFL footballer and has got a really good health story, and we had a gentleman, David Corder from Beyond Blue, also attended on the day. So the first day we said we'd cap it at 100. We had 75 prisoners attend. We did a little survey for them. They all filled it in. So 95% would recommend to others to come. They said they had a great day. Yes, we'd recommend it. 92% would attend again, and I'm thinking that there was the 8% was 2 people who I think got the questions around the wrong way. What did you like about it? Nothing. What would you come again? Yes, so we sort of thought, but anyway, we thought that most of them enjoyed it. most enjoyed aspect of the day, they decided, was the health information that they received. So 65%, that was really what they wanted. 30% reported they wanted more health checks, and 38% reported they had no suggestions for improvement. They thought it was good the way it was. The improvements we made for the following year, we had more external agencies with health-related information. Correct care staff from other prisons attended because they were interested in maybe doing programs for their own locations. A sample bag, or our man bag, was given to all the participants with allowable content. So I just cold rang people and said, you know, this is what I want to do. Is there anything that you can offer me? And a company said, oh, I can send bottles of vitamins pills. And I said, no, I don't think so. But they sent lip balms, and, you know, we had magnets from Nutrition Australia, fridge magnets, and we made our own calendar with health messages on it. So I just got on the computer and made a calendar, and they all had that, because they don't have calendars in prison. We launched a prison recipe book. So this was a book that was made up by the prisoners and the staff, the kitchen staff, with recipes for 1 or 2, and with food that was nutritious and not exotic, and just basic things that they could take home with them. We had 100 on that day because we had the man bags. We had 100 attend because they want something for nothing. They all want something for nothing. We had a passport where they got signed, similar to what we do here, got signed, and they went into the draw for prizes, which were books, one on sport, one on fitness, one on a comedian, so things like that, one on football. We had a general surgeon, friend of mine, who volunteered to come and who had an interest in skin diseases and skin checks, and he came and he checked every single prisoner on that day. We found 2 lesions that need to be taken off, and they were removed, so that was really good. Prisoners love the man bags. A committee is going to be formed this year, or has been formed, to run our Men's Health Day this year, because it's too hard for one person. External agency feedback. So we had student nurses come to do, 100 blood pressures and 100 blood sugars, and the questionnaires that we made up. We had all that information. We did that. The inmates were so interested in what I had to say, was one of the comments from the external providers. I was really scared, but they really are just normal people, and that was a student nurse, scared to come in, but they're normal people. This is a great initiative and a small way to help these often disadvantaged men to learn about health and disease prevention. So that was an external provider as well. Our successes, partners were fully engaged in the program. Prisoners were engaged in the program. The measurable improvement in the health of prisoners and identifying any issues that they had, blood pressure checks. We had one that went on to blood pressure medication. Ongoing community partnerships, so we've formed these partnerships and they're all ongoing now and they're very supportive. Transition of healthcare on release to community, which Amanda Smith's going to discuss tomorrow, about releasing prisoners into the community. Prisoner feedback. My favourite, best day I've had in prison. If someone's been in for 5 years and they say it's the best day they've had in prison, it brings me to tears, I can tell you. I felt like a normal person again. I forgot I was in prison today. The information here was great, and it was so good to meet some new people. Thank you.
So did anyone have any questions for Dianne? No?
No questions.
Well. Okay.
Oh,
yes. Okay, 2 secs, I'll get the mic to you.
yes. Everybody is offered screening and encouraged to have it. So every prisoner in Victoria is offered screening. Yeah. And we do encourage them to do it, but some decline, frightened of needles and, big sooky men with lots of tattoos. But, it's offered, and immunisation programs are offered as well.
Fabulous. Thank you very, very much.
Thank you.
That was tremendous insight into your role. Thank you very much, Dianne.